Namaste. I am Dr. Suresh Swarnapuri. I am an Ayurvedic doctor. I did my Ayurveda with the two diplomas, that is BAMS and MD in Ayurveda. And I'm an associate professor in the college in Bangalore. The meaning of Ayurveda is knowledge of life. It is not knowledge of medical science, it's knowledge of life. Means the medical science is one entity, life is bigger than the medical science. So Ayurveda explains the beyond the medical science level, which is connected to the physical, that is medical, philosophical and spiritual. It was told by our old sages, and we call them rishis, ancient ancestors of our country, and they got this knowledge with the divine power. The analytical capacity, the intellectual levels are so high, they used to visualize the science, and it's a divine knowledge which is coming from ancestors to the next level, the next level, the next level. So like that, this science is now evolved from way back from 5,000 years old. It's a very ancient traditional system. Of course, Ayurveda is maybe originated from India or those subcontinent level. Those days, 5,000 years back, there was no India. It's a combination of different countries. It's a big subcontinent. So let's put it like that, it's a subcontinental science more than India. Of course, it's a Vedic tradition. It's one of the part of Vedas. We have 4 Vedas: Samaveda, Atharvaveda, Yajurveda, all these Atharvavedas. These 4 Vedas, Rigveda. In that, the Ayurveda comes as a part of Atharva Veda. In that Vedas also, the Ayurveda was explained in a way, the physical diseases and everything was explained in Ayurveda. So those Ayurveda has been more organized. The science of this medical science in Ayurveda is more organized into more philosophical, spiritual and medical. This tradition, the Ayurveda, is practiced in India. It's practiced, it's a diploma where they are giving degrees in India. It's a recognized science in India. So it's a traditional system in India, it's an official science in India. But now, more and more European countries, Western countries, and Americans, and Japanese, and Korea, and all the Australia, all these countries, CIS countries like Russia, Ukraine, all these countries, Hungary, they all began to understand this science, the methodology of this science, the evolution of this science. And this science is so beautiful, it can be adaptable anywhere, any part of the world. That's the beauty of Ayurveda. And we have seen it practically, we have seen the results of the people, and Ayurveda is wonderfully works on because Ayurveda works better because of the dosha levels. These 3 doshas concept is very flexible. We can, variations are there. These 3 doshas is applicable to all the countries, irrespective of the zones, irrespective of the geographical positions of these countries. That is why it's easy for Ayurveda to understand the countries, and Ayurveda can be easily accommodated in particular zones of the countries in any part of the Europe or in the Western countries. I come to Croatia since 12 years, and I'm practicing in Zagreb city since a long time, and I see patients, plenty of patients from all over across the Croatia, also neighboring countries like Bosnia, Serbia, Austria, and Slovenia, and Italy. The kind of diseases which I'm used to see in Croatia, which are more related to the neuropsychiatric diseases, which involves multiple sclerosis, which involves Down syndrome, which involves epileptic cases, which involve depression, which involve insomnia cases, and which also involves the polymyelitis conditions, and a lot of polyarthritis conditions we prevail in this part of the world. So this part of the world has different seasons, different climates, and different the climatic expressions, let me say the climatic expressions. So we have to adapt the Ayurveda according to the present situations prevail in these countries. So I try to understand the psychology of the country, I try to understand the food and culture of the country, and how to make this Ayurveda adaptable science for this part of the world. So every country has different doshas dominant in these particular countries. If you go to the Western Europe, if you go to the Eastern Europe, and go to Southern Europe or the Northern Europe, the different doshas are prevailing. Mostly, according to my understanding, this Croatia is dominated by Vata and Pitta doshas. So when I am taking the individual person into consideration, I try to understand the difference between the nature, the climatic condition, and the difference between the human, the individual doshas. So I try to match this, the nature as well as the human, and understand the differences between them. I try to calculate and try to understand the lifestyle of the person. According to Ayurveda, we have different technologies or different methods of examinations. We try to analyze a person's mental and physical level. I always say it is not only the diagnostic method, it's one of the diagnostic methods in Ayurveda called pulse diagnosis or pulse screening. Let me put it like this: more than diagnosis, I would like to put it as a pulse screening. You see, in the modern system, the pulse diagnosis, they just see the pulse, they assess the tachycardia or bradycardia, or what is the normal pulse rate, which is 72 per minute. Individually, it varies according to the cardiac conditions and according to the age, according to the gender, the pulse rate can change. Whereas in Ayurveda, we focus on different levels totally. The perception, the approach of Ayurveda is entirely different from the modern system. We need to understand three doshas of the human physiology, that is Vata, Pitta and Kapha. These three fingers we try to put on the pulse, and we try to analyze what doshas are dominant in this pulse. The pulse vibrates over these fingers. So upon of the vibrations of the pulsations you feel in these three fingers, we try to analyze what are the body parts is involved in this, whether it is a psychological condition, whether it's a physical level, and what are the systems are involved. So each finger denotes a particular area of the body. This first finger mainly on the nervous system, and even the whole of the arterial system or whole of the skeletal system. The second finger basically works on the digestive system or the circular system too. We work on that. Even at the mental level, we go to the psychological analysis of the brain. And third finger basically works on the skeletal system once again and immune system. The main benefit of this pulse diagnosis is prevention, because as in the modern science, you try to understand what is a disease only of the symptoms which is 80% formed, then only it forms as a disease. Whereas in Ayurveda, even 20%, when the symptoms are forming, before they form the diseases, we can try to pick up the what's going to happen in the future. So the pulse diagnosis is not just to understand what the cardiac rate, what is the heart rate. According to the modern system, the pulse also helps you to understand the psychic level, the physical level of the human physiology, and the different areas of the systems. All the systems like cardiovascular system, respiratory system, digestive system, skeletal system, all the 8 systems can be screened through these 3 fingers. That's how the pulse diagnosis will help us to understand the prevention. With these three fingers of analysis, we can able to work on the patient prevention, detoxification and rejuvenation programs. When the patient comes to us, we focus more on the daily routines because most of the people in Croatia or the neighboring countries, their lifestyle is in jeopardy. Their lifestyle is not in proper, or maybe they doesn't know how to organize their daily lifestyle. Most of the Croatians or nearby countries, they think that they should have organic food. They're more towards the organic foods and trying to go to the bio shops and trying to buy the organic foods. But I always tell them, you need to have an organic lifestyle. That's what the main thing I try to tell the people. And we try to fix the daily routines of the person, and we try to fix the food, different kind of foods which suits to their pulse. So like for example, a person is having Vata Pitta or Pitta Vata or Kapha Vata, whatever it is, according to the pulse what we see, we design the food program for them. We design the food according to the seasons. We design the food according to the human physiology and the imbalances of the mental and physical level. Remember, the food is designed not just for physical, the food is designed with the mental level. That's what Ayurveda scores an extra benefit from the other systems. The seasonal changes also, it's important to change the food. And the food, even daily routines, the morning food changes from the afternoon and evening foods. There should be some changes in the food habits on the timing of the day. So that the changes in the lifestyle is very important. For example, in the morning there is a dominant of Kapha. In the afternoon there is a dominant of Pitta. In the evening the dominant of Vata is there. So we choose the food according to the changes of the day. We also choose the food according to the changes in the physiology. We also choose the food what season prevails on that particular day. The whole calculation goes with all the things surrounding the nature, physiology, mental level. We calculate, we design the food according to that. So there is a individual changes, individual analysis is very important with the food. Many people are asking me why you are removing my onions and garlic, which is favorite food for us, which is good for the immune system, which garlic is very good for respiratory problems in this part of the world. On the whole, the country is more of Vata and Pitta dominance, the country itself, geographical position. And individually you take, these people are very emotional and very nervous. People are very nervous and Pitta is very dominating in these people, Vata and Pitta. So mentally, they are going for, they have the onion and garlic, they are tamasic foods, which can create more mental disorders according to Ayurveda. So I try to snap them for a couple of months or a month to see through that this will not affect the mental level of the person. And also because the dominance of Vata and Pitta is there, these people are more prone for gastric inflammations, and they're more prone for intestinal inflammations, more or Crohn's disease are seen in these countries, in this part of the world. So I try to remove few. For example, I just give you one example, onions and garlic, why I'm trying to remove it. So it plays a very important role. So once we balance them, the physiology, then we bring back to the health to the normal condition from disease level, then we reintroduced it little, couple of days in a week, once a day, once in a week, like that we introduce them. When it comes to potatoes, it's another favorite food for Croatians and almost all European food. Without potatoes, they can't live here. So sometimes we try, according to Ayurveda, the potatoes increases the Vata. It's a simple thing, basic things, everybody knows this. So in winter season, like for example, now we have a snow in Zagreb right now. So in this winter season, if you drink more potatoes, it increases your Vata in the physiology. Whereas the nature is increased, Vata is there, and your physiology, Vata is increased, and you're taking the vegetables which increases Vata. So everywhere there is a Vata. So people will get into the Vata disorders. Like mentally they get affected. With the food can play a major role on the psychic, according to Ayurveda. And also physical level. They're more prone for pains in the joints, more prone for nervous system disorders, mental disorders. So this may not be the main reason for the problem, the food, but it also can be one of plays an important role in the psychic level. So we try to remove that. apart from the Panchakarma, we do Upakarmas. Shirodhara is one which is putting oil on the head region for 30-40 minutes. It works on the insomnia, it works on all the neurological diseases, it works on plenty of changes in the psychic levels according to the seasons too. I use Shirodhara most in these countries for the blood pressure. It works very well. And also Abhyanga, that is oil massages. We use this for the microcirculations and stimulations of the muscle levels, bones. We try to improve the peripheral circulation through this Abhyanga, Pindashvedana. And there is another treatment which is very good for winter. Right now in winter, I suggest you to go for this treatment, which is made up of rice bowl with kind of herbal products which is used in that. Nasya is a fantastic program, not only for sinuses, not only for allergies. We use Nasya also for the migraine, headaches, all the diseases, also for the nose treatment for allergies. So a lot of allergies is going to come up in the future from spring, early spring, and many of the people in this Croatian part, they have ambrosia, plenty of ambrosias. We are doing excellent program for the anti-allergic treatment we have in Ayurveda, a fantastic results we give. Of course, not just treatment. We need to correct the metabolism, we need to correct the mental system, we need to correct the daily routines and seasonal routines. Shirodhara, Abhyanga, Pindashvedana, they are called as associated treatments. The mainline treatments are Panchakarmas. There are 5, which is Vamana, Virechana, Basti, Nasya and Rakta Mokshana. Of course, this Rakta Mokshana treatment, blood-letting treatment, we are not doing right now because of the legal issues in Europe. So, but Vamana also we are trying to do sometimes for all the kapha disorders like asthma and all those things, the toxins removal through the mouth. It's called Vamana. And Virechana is toxins removal through the stools. It's called Virechana. We are also doing here with a great success because when the spring season comes here, most of the Croatians, they're developing skin disorders here like psoriasis, eczema. So we are trying to give the Panchakarma programs for them to detoxify the body. Most of the Croatians, they have sciatica, the neurological problems they are all having. So we are trying to give the enemas. Basti means enemas according to Ayurveda. We have 3 kinds of bastis we are doing here, which is oil enemas we are doing with the decoctions. So to detoxify the physiology and to rejuvenate the physiology, we have a program, and to rejuvenate the nervous system, we use the basti. That is mainly we work on the vata. Very basic knowledge of Ayurveda is the lifestyle. To understand the lifestyle of a person is most important thing. My practice goes in that direction. I don't think about medicines. I don't think about any other things other than the first concentration is the change of the person. The lifestyle of a person is the key for all the success. So we apply this 3 doshas concept on the human physiology and we try to change the lifestyle of a person. So that is why we work with the nature and the human body in tandem. The human body is nothing but the part of universe. That's what Ayurveda explains. That is the reason we try to work all the time with the lifestyle of a person, lifestyle of the nature. There is a lifestyle of the nature. It changes all the seasons. And the lifestyle of the person also changes according to the nature. So these are the elementary basics of Ayurveda. We connect the human human physiology with the nature surrounding the human body. Kitchen is nothing but a pharmacy according to Ayurveda. We can use kitchen as good as any apteka, any medical shops. And that kind of information is available in Ayurveda, how to balance these doshas with the kitchen pharmacy. So simple thing, let me take an allergy. So most of the thing in allergies, what they do is they go to the doctor, they take the sprays, they do the symptomatic relief. But how to combat allergies from the kitchen? So for example, let me take 4 spices: black pepper, curcuma, basilicum and ginger. Ginger acts as anti-inflammatory. Any respiratory infections will develop inflammations in the mucosal level, levels in the mucosa of the throat, mucosa of the sinuses, inflammations. The best is ginger acts as an anti-inflammatory. The second is black pepper. Black pepper is a fantastic antihistamine. Because when the season, spring season, now is going to be spring season in Croatia, it's going to be a lot of ambrosia is going to develop here. So we use black pepper as an anti-allergy. That is, it acts as the anti-allergic, that is it works on the immunoglobulins. And third is the curcuma, that's turmeric. Turmeric acts as antiseptic. It has a great action on inflammations once again, and it works on all the antibacteria, it works on the infections of the physiology. So turmeric is very, very good to prevent any secondary inflammations of allergy. And basilicum acts as anti-allergy. That means it prevents allergies, manifestations in the physiology. It increases the immune system, raises the immune system in the body, so it combats the regular ambrosia or allergies which is going to take place in the future. I always tell basilicum is a kitchen herbs. I don't say these four, or according to me, they are herbs, they are not spices. It works as a prevention. It also works during the acute conditions too, these four spices. So this is an example of the kitchen Ayurveda. Now we'll come to the classical herbal herbs, Ayurveda. So it's not enough for us to use only spices to treat the diseases. We need something herbs which can work on different areas. Some of the herbs like Brahmi, Ashwagandha, all these things, herbs which is used on the neurological conditions, which is used on the brain cells and coordination in the brain, and to improve the peripheral neurological functions. So we got some of the fantastic herbs. More than this, there is a varied range of herbs are available on different systems, and we use a lot of oils here to combat. It works on a lot of oils also we have. It works on the neuropsychological, psychiatric conditions like Brahmi oil, we have Dhanvantari oil, we have Ksheramala oil. There are so many herbal oils are available. We are also bringing it from India and we are using here. Also, for the digestive system, simple herbs are available. Simple things like amla, that is Indian gooseberries. It's also available in Croatia. Most of the Croatian aptikas also they do available these days. Neem powder, amla, Brahmi, Shatavari, Ashwagandha. These are simple things, basics. Most of the Europeans knows this by this time. But if there is a range of the diseases goes higher, for multiple sclerosis, for the different kind of Down syndromes, and also Crohn's disease, we have a varied range of herbs are available. We try to combination of the herbs. Also we use sometimes Maharshi Ayurveda products. Also they have a varied range of herbs is available for the along with the top diseases which is prevailing in Croatia, and children diseases too. Mostly in Croatia, they have problems with the circulatory system, respiratory system, and neurological system, according to me. And also, they have a lot of problem with the skeletal systems here in Croatia. Most of the diseases, 60%, according to me, my analysis of coming to Croatia or these Mediterranean countries for a long term is neuropsychological disorders they have. First thing we need to understand is the both system has different approach to the physiology. We are more towards the systemic approach. The modern science more of the symptomatic. Two different shades of treatment is going on. And chemicals, only the main line of treatment for the disease to suppress or to remove. Whereas in Ayurveda, herbs plays a part of the treatment. That's the major difference. The chemicals, they are the main one. That's all. There is no other than the chemicals. They can eat food. They can do anything what they want. Along with that, they can take the tablets or the chemicals to suppress the diseases. It is symptomatic relief they get. Here, we need to understand they are not working on the disease. But in Ayurveda, it's a collective program. It's a compaction of the total complexion for the treatment of the disease. So here the thing is, we take, as we discussed earlier, we take the season into consideration, we take daily routine into consideration, we take the physiological changes into consideration, we take Tridoshas concept and Dhatu concept. All these are all very essential part we consider before the treatment. And according to Ayurveda, the herbs acts only when all the other area parameters are in line with that. So when we are changing the lifestyle of a person, even though they are taking the chemicals, and that this can neutralize the chemical effect of the what are the chemicals they are taking. So we are trying to work on the change of the physiology, and through that the herbs can be taken along with the chemicals. There is no harm in that. Of course, some of the cases we tell them how long you should take and what you should take and how long you should replace these chemicals. The whole planning is we are going to replace the chemicals over the period of times with the Ayurveda. That's the whole planning. And how we do it is in a step-by-step, in a gradual way, in a methodical way. We try to replace the chemicals. We don't like to chemicals immediately to stop or withdraw, because the chemicals which the doctor prescribes in your hospitals can be, if you withdraw suddenly, it can cause adverse effects, withdrawal syndromes. So it's better not to stop the medicines immediately. So we replace them slowly, gradually. We change the system of a person, we change the lifestyle of a person, we change the metabolism of the person. So slowly, when the general health improves, so the necessity of the chemicals goes down. And we try to simultaneously introduce the herbs. So the herbs will start taking action, will start acting on the cellular level and psychical level and physiological level. We try to work on the metabolism. That's the most important in Ayurveda. We try to work on the Agni. We call it as Agni. That's the digestive fire. We work on them. So slowly, we try to replace the chemicals with the herbs. Let's take an example of autoimmune disorders. Most of the patients who are coming here, they have autoimmune disorder. Many autoimmune disorders, they're afraid because they're on immunosuppressants. And they think that with the immunosuppressants, they have to take whole life, according to the doctors. Immunosuppressants, methotrexate or Imuron, they use these kind of chemicals to suppress the immune system so that the symptoms will be under control. But according to Ayurveda, it's a different approach altogether. We are not going to increase the immune system, or nor we are going to decrease the immune system here. We are going to correct the system as it is. We are going to balance the doshas here. We are not talking about the immunoglobulins or other part of the how it causes the immune system suppressors. We are not talking about that. But changing of the metabolism, changing of the lifestyle, we can bring back naturally the immune system to balanced condition. And we also give herbs to the person. Most of the people, they think that all the Ayurvedic herbs are immunomodulators. They increase the immune system, so it will affect the autoimmune disorders. It is not correct. We have a fantastic treatment for all the autoimmune disorders. For example, rheumatoid arthritis, a fantastic treatment. We have different levels because we work on the doshas. We don't work on the immune system directly. If you work only on the immunosuppressants, then we need to find some herbs which works only on the immune system in our Ayurveda. We don't do that. We work on the doshas here, we work on the Agni here, we try to balance the Agni here. Once the Agni is balanced, then definitely other dhatu, the tissue levels, which the transformation of the one tissue to another tissue where the defect is taking place in the immune system can be controlled. That's the whole idea of doing the Ayurvedic treatments. In the same way, we also give some herbs to promote the Agni, that is the main essential element for the transformation of one tissue into another tissues. That's how we work in from deeper level. Here we don't suppress the immune system. We try to organize the immune system in such a way the person improves. My way of working is the medicine in the last. First is correcting the system, correcting the food habits, correcting the lifestyle, correcting the Agni, correcting the digestive fire, correcting the tissues, which is transforming. That's why there is no harm in taking Ayurvedic herbs in parallel with the your Immuron or methotrexate first. In fact, Ayurvedic herbs helps the side effects of the methotrexate. We have seen the great results in Crohn's disease. We have seen the great results in arthritis, and a lot of autoimmune disorders has improved quite well with the Ayurvedic medicines. It is possible to help out patients with Ayurvedic herbs in autoimmune disorders. Thank you.